I'm gonna record now. Is it recording? Yes, it is recording now.
Right.
Yeah.
Can I just start by saying, for those of you who are here, thank you for being here. I'm sure Dr. Tahir would agree with me that we would love to encourage your participation in this seminar. It shouldn't be just a listening session. If you have any questions or you want to engage with our speaker today, please do feel free to do so, either using the chat option or by raising your hand and allowing Dr. Tahir to give you an opportunity to speak. Okay? Go ahead, Lana. Thank you.
Okay, so thank you, Ms. Gershon, for the intro and for the remarks. I would like to welcome everyone for this webinar. We were hoping to host this in person as we discussed it with Dr. Tahir before the break, but unfortunately it was not possible. But I'm glad that we're all connected here virtually from the comfort of our homes and without the risk of getting infected with COVID-19. So this series of webinars will be a part of Code Blue, hopefully for the next following weeks. Each week we will have a webinar just like this, where students can attend, listen to a presentation, and then ask their questions if they had any. Hopefully you will be able to learn something from this, which I'm sure, because Dr. Tahir has prepared a great presentation. And for those who are Code Blue members, participation points will be awarded to you, as we mentioned in our orientation. I don't want to make it any more longer. Dr. Tahir, the floor is yours. You can say any introduction words, or you can just start your presentation right away.
Thank you very much, Lano, and thanks again, Ms. Goshen, for inviting me for this nice webinar. And I would like to thank each member of this community, and we would encourage you to participate in more of these activities, and actually just to say that we are all proud of you all right? I prepared actually it was a short notice somewhat, so I prepared something for you, and hopefully you will like it. Let me share how much time do I have, Lano?
You can spend any time from 30 minutes to 40 minutes, and you can spend less time on it. It's up to you, completely up to you.
Okay. Okay, it's just because you know me, I used to repeat again and again, and so I'll go quickly on it now. All right.
Okay.
The webinar is about learning and memory. All right. And let's start. Learning and memory are both one of the most important higher functions of the cerebral cortex, or of the brain, of the human brain. All right. So we can give a little division, about learning and memory. So we can say learning is the acquisition of knowledge, while memory is the retention of knowledge. In simplest form, acquisition is learning, and retention of the knowledge is memory. Learning is the neural mechanism by which person changes his or her behavior depending on past experience, right? So if I touch something hot, I learn that not to touch it again because it's hot, all right? Memory is the neural mechanism for storing what is learned, all right? Both learning and memory give us the ability to adjust our responses depending on past information. So learning and memory together work together to shape our future behavior, right? So we need to learn to behave as well properly. Stages of memory process. How to remember things? 3 stages. We can see it, the whole process. We can look at it from 3 stages, as it is made of 3 stages. Encoding, or reception, or registration. When you got information, actually, every day, every minute, we are bombarded with a lot of sensory input from our environment and inside our body as well. So we have continuous sensory input inside and out. Which one do we need to keep? Which one we don't want to keep, which one we memorize, which one won't memorize. This is actually a function of the brain. The brain chooses to us, and sometimes we do it intentionally. We do it on purpose, right? So the reception is the first stage, which we call encoding, because this involves encoding or giving the information a code to be stored. All right, just like when you put something in the computer gives it a code, and we, keep it in the memory. Then the second stage is storage and retention, which is maintaining the encoded information in the memory stores over a period of time. Could be short, could be long. And then the last stage is the recall and retrieval, all right, which is recovering the information from the memory stores. Right, so encoding, storing, retrieving. This is the memory. Memory can be classified based on two criteria. Based on the nature of the information itself, whether it is declarative or non-declarative, and I will tell you what does that mean. Or it depends on the duration or the period of time over which the memorized information persisted. Is it a short term, long term, or sensory, just like a very ultra short one? So memory as a duration can be described as a pathway with certain piece of information passing from one level to the other, to the next. So therefore, could be stored for a longer time. And the shortest is the sensory memory. Then we have, which lasts less than a second, fraction of a second, then short-term memory, seconds to minutes, and then the long-term memory, anything from hours to lifetime. Right, so let's talk something about we said the nature or the function of the memory. So it could be declarative or non-declarative. So our people may call it explicit or implicit memory. So the first one, the declarative or the explicit memory, is the memory of fact and events. Each one of us, knows many facts and knows many people, right? And knows many events. So the memory of facts and events is the declarative one. This memory, we call it the what, right? What person, what event, what date, what time. So the what memory. This is a factual knowledge of people, places, things, meanings, facts of things. And to recall, it requires conscious search of the memory. Right? So, oh, I know you. You must be the one who I saw last week. So active searching. And it's expressed in verbal form. So one is able to describe it in words. He says, how did you find that place? Oh, it's a big place, very spacious. The air is nice. So you can express it in words. So it's in a verbal form. And it fades with the time, especially if it's not reactivated. So these are the features of what we call declarative memory. And scientists divide the declarative memory into two types, actually, semantic and episodic. That's a nice one, actually. So semantic is the memory of fact, pure fact. Do not have to have experienced it yourself. You say, well, the North Sea is very cold. It's a fact. You don't have to dip into the North Sea to say that it is cold, right? See? So it's a pure fact. And you don't have to experience it personally. And you don't express it in temporal form. So you don't have time. You don't time it. This is semantic. The episodic, like semantic pure facts, and this involves person, places, things like that. Episodic, these are events that we personally experienced, and with temporal aspect. Temporal means timing, so you can time it. Oh yes, in year 2002 I had my first child, so you can time it. It is an event. It's episodic. So we have semantic and episodic, and both These are the declarative memory, all right? What about non-declarative memory? This is the implicit. So we have explicit, declarative, or non-declarative, implicit. This is the how memory. How do I do this? So this is the memory of skills, habits, and behavior. It builds up slowly with repetition over many traits, okay? So you learn how to ride a bicycle. You may fall once, twice, and then when you learn, and then you do it unconsciously, subconsciously. That's why you can recall it unconsciously. You drive. Sometimes you drive from the uni to home without remembering which way you took, you know, because you do it unconsciously, because you did it 100 times. I hope. Nowadays, I don't think you did it 100 times. Well, expressed mainly in the form of performance. So skills, behavior, you perform it. So you express it not in words, but in performance. And cannot be described actually in words. Types, we said they're semantic and episodic. Here, we can call it procedural memory, which is the memory of motor task. How to do this, how to do that, how to open a motor, how to fix a clock, things like that. Conditioned response, these are, we are going to talk about this, involve the association between two factors and the response to it. This is classical conditioning we are going to talk about. And then emotional responses, which describe the memory associated with feeling and emotion. If you had a nice time or felt good about something, you will always remember that. Oh, I remember when we went to Corfu, you know, in Greece, a few years ago. It was lovely, really. I cannot forget it. I cannot give it off my mind, really. So when you have a good time somewhere with nice people, you will remember it forever. So this is the emotional response. So this is part of non-declarative memory. You don't need to actively search your memory to get it. No, it will be always in your mind passively, right? So this is non-declarative. So we have declarative, non-declarative. And these two forms are the nature of the memory. So shall we go for the duration, or somebody has got a question? Right, let's go, because there's a lot of things to say. And if you give me only 40 minutes, I need to hurry. Right, so the other one is the duration of the memory. So we said sensory is the ultra short one. It's the shortest form of memory. It lasts a fraction of a second. The brief retention of sensory input received by the brain while something is being scanned, evaluated, or acted. When you talk, you know, you need to remember what you just said. When you write something, you need to remember what you just written. So it's a brief retention of the sensory input and functions to allow sensory processing. Sensory processing is the perception of all the sensory input around you. So allows you to make a sense of various stimuli, which has an impact on your body. And it always occurs in the temporal lobe. So the sensory memory, the ultra short one, is in the temporal lobe. For those who do not know what's the temporal, you know, the brain has got temporal lobe, has got frontal lobe, occipital lobe, parietal lobe. I hope the anatomy student knows that, I hope. Right, so the sensory memory, then we have short-term memory. Processed sensory memory is converted into short-term memory. Not necessarily, you might just forget it, you might just give it up, but it might be converted into short-term memory. Short-term memory is to be remembered for seconds, for about 30 seconds, half a minute. This is a short-term memory. The data held in the sensory memory can be moved still within the temporal lobe into short-term memory, where it is retained for seconds to few minutes, okay? The short-term memory is limited by the number of bits of information that can be stored at any one time. Short-term memory cannot have a lot of items in it, maximally 7, plus minus 2. And that's now you think, why do all telephone numbers do not exceed 7? Yeah, 7 plus the first 4, you know, these are the area code. You may get it plus minus, but usually when you say something, you know, for somebody quickly, verbally, and you expect him to remember, you shouldn't exceed more than 7 items. When new information is presented, old information, right? Let me just put this in. Sorry. When the new information is presented, old information, which is previously stored in the short-term memory, is eliminated. So short-term memory is not like you cannot heap one information of what other. So you need to keep those which are important, and those, they go over each other. The transition from sensory memory to short-term memory may occur if the temporal lobe is damaged. It won't occur, may not occur if the temporal lobe is damaged. So damage of the temporal lobe will make us lose the short-term memory. What does that mean? It means that, yeah, I can remember you when you're talking to me, but if you go out of the room and come back, this exceeds 30 seconds. So I said, sorry, who are you? You've been talking to, I said, I've been talking to you just now. Sorry, I didn't know you. So the person will live in the present only. Of course, you know, funny enough, this person who lives in the present only with the temporal lobe damage, they can remember their childhood. What does that tell you? That tells you that the way the memory is stored, the long-term memory, is different. It's not only the way and the site in the brain is different. So when you get temporal lobe damage or problem or lesion, you lose only the short-term memory, and you live in the present and in the remote past when all the information has been stored before the lesion. Because unfortunately, you need the temporal lobe not only to process the present memory, but to change the memory, the short-term memory, into long-term memory, to consolidate, they call it, consolidate the memory, okay? Let's go. So we have sensory memory, we have short-term memory, and we have long-term memory. The long-term memory, certain information are transferred from short-term memory to long-term memory. These may last for only a few minutes or may last forever, become permanent. And long-term memory involves physical change in the neuron shape. We are going to talk a little bit about the physiology of how do information stored in the nervous tissue, right? We are going to talk about it. But long-term memory involves physical change. And this is called consolidation. So it requires a neurological change to consolidate information from short-term memory to long-term memory. The series of neurons that are involved in the long-term memory retention and information, they call it memory traces or memory engrams. And these are circuits and connections that are there. Some neurons, group of neurons that has been changed forever, and they stay there. Right. Rehearsal. Of course, long-term memory has seemingly unlimited capacity. We said the short-term memory, you know, if you get new information, this will be on expense of the information already stored in it. But because it's very short, so this will go one over time, one over the other. But the long-term memory has unlimited capacity. It all depends on training. You need to find somewhere in your brain and you will get it. Right. Rehearsal of the information assists in the transfer of information from short-term memory to long-term memory. There is also some evidence that sensory memory may be able to bypass the short memory from sensory to long-term memory, go just that way. So here, we always have the sensory input, continuous sensory input, and this goes to the sensory memory, fraction of a second, and then change this temporal lobe, and then change into the short-term memory, right? But you can lose the information here. Either you lose it or you transfer it to the short-term memory. And the short-term memory, either you lose it or you rehearse it, and then it will be transferred into the long-term memory, right? There's some concept you may hear about it, working memory. What is working memory? Working memory is a form of short-term memory, actually, but that keeps information available usually for a very short period of time while the individual plans action based on that information. So the ability to keep information consciously for a short time is called working memory, such as, you know, when you go shopping, you have a list in your mind, you know, just to what to shop and things like that. And the working memory actually is associated with the prefrontal cortex, and it is impaired in children with ADHD. You know, ADHD, attention deficit hyperactivity disorder. These children who they do not listen, you know, they have a problem attention or listening. So they have problem with the sensory, with the working memory. And also patients with schizophrenia will have that as well. Right. Anatomical location of memory. Right. Let's stop now. Any problem? Any question? Anybody has anything to tell us?
So if anyone has any questions, they can just go ahead and unmute themselves, or if they wish, they can just put it in the chat.
All right. So shall I just move on?
I guess so, yes.
All right. So now we know the declarative and non-declarative memory, and we know the sensory memory, short-term memory, and long-term memory. So where anatomical location of the memory. Formerly, in the past, they believed that memory was diffusely located in the brain. And the stimulation of the correct location of the cortex retrieved the memory, right? But nowadays, researchers has a very good reason to believe that particular aspect of the memory, the visual, the auditory, the olfactory, the spatial, etc., all stored in particular area. So all parts of the brain will share in memorizing different aspects of that memory, of that memorable experience. And the cooperation of all these areas is needed to elicit a complete memory. The information about the relationship between different anatomical brain regions and their role in the memory storage, consolidation, and retrieval were extracted from where? Where do we get the evidence? We get the evidence from observations of patient with brain injury. Sometimes a patient gets injury to the brain, and then he will develop certain types of amnesia. Amnesia is a loss of memory. So we know that this lesion or the lesion of this part will produce such type of amnesia. So that's how we observe patients with brain injury, number one. Number two, recently, or not recently, probably last 30, 40 years, with the functional MRI, you know, the magnetic resonance imaging. They do functional. What is functional? They scan, they do MRI while asking the patient to do a task or to remember something. So, and they see which area is active when he remembers something. And that's how they, try to get an idea about where the memory lies and things like that. So functional MRI, functional magnetic resonance imaging. Also, where do you get it from? From clinical studies of amnesia. Amnesia is loss of memory. And it suggests that these studies of amnesia suggest that several different brain regions are involved in the memory storage and retrieval. Amnesia resulted from damage to temporal lobe of cerebral cortex, hippocampus. You know, the hippocampus is the medial lobe or medial part of the temporal lobe, the hippocampus and the rhinal cortex, you know, the gyrus, rhinal gyrus, right? The uncus, they call it. Head of caudate nucleus, you know, the corpus striatum, we said caudate nucleus, potamen, global. The caudate nucleus, the head of it, if it is damaged, it will give you the amnesia of Huntington chorea. Huntington chorea is some sort of dementia, all right? And it will lead to loss of memory and the pathology there in the head of the caudate. So you observe so that you get an idea about where this lesion, this part function from, absence of that function when the lesion is affected that part. Dorsomedial thalamus gives you the Korsakoff syndrome of alcoholic. Korsakoff syndrome is a syndrome on alcoholic. When the alcohol, the thiamine deficiency in alcoholics, it will cause some sort of damage to the part of the thalamus, and the patient will develop what we call Korsakoff syndrome. The patient will actually have will lose bits of memory from his memory. So when he talks about something, he forgot things in the middle of the talk. So what he will do confabulation. He will try to put other facts in the gaps just to fill it. So this is he's not lying actually, but this is just like a brain phenomenon. They call it Korsakoff syndrome. And just to for interest, Wilder Penfield, this is a neuro scientist. He electrically stimulated various brain regions in awake patients, volunteers. He stimulated various parts of their brain, and he tried to tell them, what did you feel? What did that bring? What memories that bring you? And actually, certain areas in the brain, when stimulated, they brought vivid memories to the brain of these volunteers. Some visual, they saw their father coming, when he was dying and he was coming. So they were frightened probably by the experience because it looked so real, as if they have lived that experience when stimulated. That was a bit probably unethical. Ms. Goshen can tell us if this is ethical or not, but it was vivid, and the patients relived their experience. So it's there. Although, they might have not remembered the experience without this stimulation. Right. This is like a table to show you the type of the memory and where it is stored actually. And these are the main parts of the body that stores these types of memories, and the length of the memory and an example, okay? And this one, just like the brain here, you can see the brain. This is the hippocampus, and this is the amygdaloid body. And this is the prefrontal cortex, and this is the cerebellum. Just a few words. You see, the prefrontal cortex, this one, it gives you memory involving the sequence of events, but not the events themselves. So you see, the frontal lobe has got a function to give you the sequence of the events, but not the events of themselves. The amygdala, it gives you the emotional aspects of the memory. It's not the memory itself, but the emotional aspect. When there is damage, you won't lose the memory, but you lose that feeling which comes with the memory. The hippocampus here, this is everything really. The most important part of the brain involved in memory is the hippocampus. The hippocampus encodes and transfers in new memories, in new explicit memory, from sensory to short-term and things like that, okay? And the cerebellum involves memory of movement. Right. The explicit memory, the declarative memory, is stored in the medial temporal lobe. And yeah, I'll bypass this because it's all information. It's like more scientific things really. And we said explicit memory could be semantic or could be episodic. Semantic, which is the memory of facts and episodic, the memory of events, right? The sensory information is all from the rhinal cortex or from hippocampus, and it goes to the neocortex. Neocortex, it means the cerebral cortex, okay? You can see here something in Alzheimer's disease, you lose both semantic and episodic, right? But the loss of semantic memory and episodic memory is not identical, so you lose it one after the other. And this fact, it means that the stream for episodic is not the stream of the semantic. So in the temporal lobe, even there is part for the semantic and part for the episodic. Things like that, okay? The implicit is where stored in the basal ganglia, in the motor association area, in the cerebellum, okay? So this is a procedural. And that's why in Parkinson's disease, which is a disease of the movement, you lose your skills that you learned for years, right? Right. I don't know whether I want you to know all this because, you know, you might take some time. So probably I'll skip this. But just to give you a quick thing, you know, the frontal lobe. The frontal lobe, you can simulate it to a file clerk, you know, a clerk who will file the files, right? So the frontal lobe is involved in registration, acquisition, and encoding of the information. The retrieval of information without contextual or other cues. So the recollection of the source of information and the assessment of temporal sequence of events is not is part of the frontal lobe, really. So it permits the person to focus on the information to be remembered and engage in the medial temporal lobe. So just give you the sequence of the facts of the events and the facts themselves. This function of the frontal lobe, what will cause? It causes distortion because there will be problem in the filing. So it will be distortion of the memories, the context of the memory and the sequence of the memory and the accuracy of the information. It will all be impaired. The medial temporal lobe is the recent memory file cabinet. You know, you have a clerk and you have cabinet, file cabinet for recent memory and file cabinet for long-term memory. For the recent memory, the file cabinet is the medial temporal lobes, which is the hippocampus and the amygdala. While the long-term file memory, file cabinet is the cortical areas, the association areas all over the brain cortex, right? I won't say how long, and this is the remote command, right? As I said, memory deficit. Memory deficit, forgetting certain declarative memories is normal. So we always, you know, forget facts, forget faces, forget people, forget things. This is not abnormal. And it is an essential process sometimes because sometimes we need to forget, really. It is not useful for us to retain information that will not be helpful in the future. And the ability to retain and recall information as memory will decline with age, and this is normal. These factors are not pathological, but the pathological is what we call amnesia. And amnesia can result from trauma, from neurodegenerative disease, from resection of part of the brain, and you can divide it into two types of amnesia. Amnesia retrograde, which is inability to recall events before the trauma, or antegrade, you won't be able to add new information, so you will have amnesia to what is coming, right? This is a case study. It's a nice one. It's like a story. So just listen to that. You see, there's a person, let's call him HM, right? This person had bilateral medial temporal lobectomy. They removed the medial temporal lobe on both sides, the hippocampus on both sides, because he had severe epilepsy. So they removed both so that they will remove the nidus for the electricity, and hopefully they will treat the epilepsy. What happened to this person? He developed severe antegrade amnesia for declarative memory. He couldn't get any new information in his memory. He cannot remember anything is happening now. So he's unable to consolidate the short-term memory after the surgery. So after the surgery, he couldn't move the short-term memory into long-term memory. So this is, they concluded that the medial temporal lobe, or this median, the hippocampus, is the part where short-term memory is converted, consolidated into long-term memory. Funny enough, his non-declarative memory, which is, the skill, the procedural memory, were intact. So he can still drive his car. He can still, eat with a knife and fork. He can still tie his shoelaces, but he couldn't get any more information in the recent. So what was affected is the declarative memory, and type of amnesia he had was antegrade. It's not the information already stored in the long-term memory, but the information that he is having now, he couldn't convert it into a long-term memory. So this implies that the temporal lobe is required to make new memories, and this person has actually lived in the present, they call it. How do neurons store memories? Do you want to know that, or shall I move? I'll leave this to the end, if you want to, because this is a more scientific thing. So let's go on learning and then come back to it. All right. So this thing, neural stem cells in memory and learning. Mammalian brains have recently been shown to contain neural stem cells. You know that? And the hippocampus, which is required for the consolidation of long-term memory, is shown to contain such stem cells. Neurogenesis, which is the differentiation of stem cells into neural tissue, or formation or production of neural tissue, has been shown to be promoted by physical exercise and by enriched environment in mice. So this is a fact. In mice, they put an enriched media, food and environment, and promoted exercise. Exercise and enriched environment helped the mouse to have neurogenesis. More tissue has been generated in his hippocampus, right? And by contrast, aging and stress has reduced neurogenesis in the mouse brain. So neurogenesis, so nowadays, scientists think that does neurogenesis has a role to do with the hippocampus dependent learning and memory? So probably when we learn, when we memorize things, we have a new neural tissue formed in our temporal lobe. And people, funny enough, people with Alzheimer, they have shrinkage of the hippocampus. And people who exercise will have the volume of the hippocampus increases all the time, So, right. I'll go back to the mechanism, how the memory is stored in the neural tissue if we have time. But I want to tell you a lot of things that are relevant to you. So let us move to the next subject. Right. Next subject is learning. Learning, you could see it as part of implicit memory, right? When you learn something, you can subconsciously do it. And there are three types of learning. Simple, which is non-associative, they call it, or associative, or complex. Simple, two types: habituation, sensitization. I will discuss what that means. Associative, which is the classical conditioning, and operant conditioning, and aversion learning, and complex learning, which is either latent or observational. I will talk about this quickly. These are the types of learning, right? Right. But before we start with learning, I want you to read this. What does it say? A smart man learns from his mistakes. A wise man learns from the mistakes of others. Is that right?
Yes.
True. So you don't, if you are wise enough, you don't have to commit the mistake to learn from it. You just need to see somebody committing it and you're learning from it. All right. That's a good one. Right. So we said learning could be non-associative, associative, or complex. And complex could be latent or observational. You see, non-associative, they call it simple learning. Subject learns about properties of single stimulus when exposed to it repeatedly, once or repeatedly. It has two forms, habituation or sensitization. What does that mean? Habituation, a decrease in response to a benign stimulus when the stimulus is presented repeatedly. Somebody who goes into like say a noisy environment, like somebody who lives in New York, a newcomer to New York, and he presented with all tatito, so he will get that. But he is repeatedly exposed to such a stimulus, then by habituation, he learns to just, the brain will learn to just ignore that. So this is called habituation. Repeated stimulus causes a response, but that response gradually diminishes as it is learned that this stimulus is not important. You know what I mean? Sensitization is the opposite. It's an enhanced response to a wide variety of stimuli after intense or noxious stimuli. يقول لك لا يلدغ المؤمن من جحن مرتين. If you get stung by something from where, you know, you will learn, you will remember that. I will never put my hand there, right? So this is because of noxious stimulus, because of the gravity of the experience, the person will learn not to repeat it. So the response will be greater. So habituation and sensitization, these are non-associative. But what is the associative? Associative is the classical conditioning. You see, there are three forms of associative, but associative learning in general, you associate between things. There is consistent relationship and timing of the stimuli. Two or more stimuli, and there is a certain timing or association between them, which will give you the learning process. So classical condition involves learning a relationship between two stimuli. Operant condition involves learning a relationship between a behavior and a consequence of behavior. If you do this, you will get that. If you did this, you will get that. So this is what they call reward and punishment type of learning. So we have classical conditioning, we have operant conditioning, and we have aversion learning. Let's talk about it quickly because it doesn't take time. You see, classical conditioning, you know, the Pavlov, the famous Pavlov experiments. You say you have conditioned stimulus and unconditioned stimulus. Two stimulus, one conditioned, one unconditioned. When the conditioned stimulus is followed by unconditioned stimulus, the conditioned stimulus will begin to elicit a new different response called conditioned response, right? Show you that. This is a dog and this is food. You give the dog food, the dog will salivate, right? So this is unconditioned because this is a natural. You give him food, he will salivate. And the response is natural, unconditioned. It's not something you condition. It's not something you learn the dog. You teach the dog. You see? So unconditioned stimulus gave unconditioned response. Now, I'll give him the unconditioned stimulus, the food, but with a whistle or a bell, and then give him. So I gave him an association. This is the conditioned stimulus, the stimulus that I want to teach him, right? There's always association between the food and the whistle. So the whistle is the condition, the food is unconditioned. When you present them both, the dog will salivate after a period of time, right? If you give only the whistle, the dog will salivate. So the dog will give conditioned response to a conditioned stimulus. So I taught him when he was salivating for food, now he's salivating for the whistle, right? So this is the conditioned response, and this is a conditioned stimulus. Okay? So this is a way of learning. So condition, they call it classical conditioning. The other one is operant. And operant, as I said, you teach a consequence of a behavior. You do this behavior, either you get punished or you get rewarded. Also called trial and error. Sometimes you do, and then if you doesn't succeed, so you do it again, right? You see, yeah, you're not rewarded, so that's why you repeat it. So learning in which behavior are emitted to obtain rewards or avoid punishment. If you read, I will reward you. If you don't read, I will punish you. So this is, they call it the stick and the carrot, you know, the asa wa jazra. And this is a way of actually raising children, you know, reward and punishment. This is, you get it all in life. Really. So this is the operant condition. In operant condition, the response to a stimulus is reinforced. How do you reinforce it? By rewarding it. And reinforce either positively or negatively. If he does an unwanted behavior, so you reinforce it negatively, you punish him. If he does the right behavior, you enforce it positively and you reward him. So it's a punishment and reward, all right? The last one is the aversion. So this is all what? These are the associative learning. The non-associative learning is the habituation and sensitization, and associative learning as these three. Okay, so the last one is aversion. Aversion, you know, in 1960, Garcia and Colling, these two scientists, they made an experiment. They irradiated the rats with a strong X-ray that damaged their GI, the gastrointestinal tract. At the same time, they gave them a tasty drink. So the poor rat, you know, he learned that this tasty solution to drink probably has caused this problem with the GI. So this has led to aversion behavior. So after recovery, the rats were presented with this tasty water to drink, but they will never drink it because they learned that this unwanted stimulus causes unwanted behavior, you see? And just similar to conditioning, really. They call it aversion learning, right? Right, so we have associative, we have non-associative, and we have complex learning. Complex learning is easy. It's two types, either latent learning or observational learning. Latent learning is a form of learning that immediately expressed in an overt response and occurs without obvious reinforcement to be applied later. For example, I'll give you an example. A child observes his parent setting a table, his mother, how to do the table, you know, or his father tightening a screw. And after a year, without observing or something, you can see this child is do the same thing. You know, it was built in his mind. This is, they call it latent. Latent is when something happening now, but it will show later on. They call it latent learning. The other one is observational. Tell them, listen, my boy, come and see how I do it so that you can do it after me. I want you to do it more better than me. So observational. Type of learning that occurs as a function of observing, retaining, and replicating what others do. So this is observational. So this is complex. Right, now we talked about learning. We said associative, non-associative, and complex learning. And we talked about all of these. We got back to the molecular basis of the memory and learning. Do we have time, Lano, or shall I just continue?
I think we can spend 3 to 5 more minutes, and we'll.
Excellent. So I won't talk about the molecular basis, but
okay.
you will have this lecture with you, so you can read about the molecular basis. But let's go for the funny bit. Let's go for the advice that I wanted you to hear. Okay. How to boost your memory, how to sharpen your memory. All right. First of all, testing. You need to test yourself. You know what? If you give 2 groups of students some time, give this group of students 1 week to prepare, and give this group of students 3 days to prepare, but test them 3 or 4 times. The group who test more than once, they will retain information far more better than those who will study for a longer period of time. Testing, putting stress on you is good sometimes. Several studies have found that being tested for information helped to create a stronger memory. Students who were I said that, okay? So the concept is test enhanced learning, they call it, based on what? Retrieval of information has greater impact on memory because you are always retrieving. When you test, you try to remember. So retrieving more and more. So this will make you remember better. Sleep. There is a neuroscientist called Dr. Matthew Walker. Dr. Matthew Walker said a nice phrase. He said, sleep is the greatest legal performance enhancing drug that people probably neglecting, right? Dr. Walker, according to Dr. Walker, sleeping at least 8 hours at night help you learn and remember new information. And it can, of course, reduce the risk of developing Alzheimer later in life. So good sleep is good. Sleep deprivation during exam period is not good because the reinforcement of memory, it's all happening during sleep. So even if you know a new thing, if you don't sleep, you won't retain it. Sleep will retain the information. Right. So test yourself, sleep more. Sensory input, that's a nice one. In addition to exercising your brain, frequently retrieving information, engaging all your senses to the experience makes a very good impact on how to remember it, especially if you involve all your 5 senses. That's why, I said being physically present in the class will make you remember more because you are not only you are seeing, you are watching, you are hearing, you are smelling, you are touching, you are interfering. So you have all your senses. When you involve all your senses, the memory will stick. So try to engage more sensory inputs in what you do. Drink some coffee. Coffee is good. Coffee is good. They say caffeine is a popular cognitive enhancer. Minimize stress. Although we are more likely to remember a particularly stressful experience. When we are under stress, probably we will remember it for a long time because we were stressed by it. But all the memories learned under stress is rarely successful. So you cannot remember it. Stress, why? Because stress alters the way our brain process the information and how the memory is stored. Right. Minimize distraction, right? Don't put a bird on your head, like Shania, or don't, try to get something to drink, get something to what, and do that, and leave the, the TV open, and and every time, oh, who texted me? All these distraction. Minimize distraction. Smell rosemary. How's that? Our AUIS is full with rosemary. Rosemary is good. In 2003, there was a funny study. A group of volunteers, they do, this testing of memory and things like that. They put the three groups, one in a room full with rosemary, one with a room full with the lavenders, and one with no taste room, just no smell, right? They found that the performance of those who smelled the rosemary, so put some rosemary in your room. It helped, right? I don't know whether this is right or not. It needs a lot of course, a lot of verification. Eat well, eat well. Eating food high in antioxidant is good because it will keep your brain young and maintain your memory. And what are these? Blueberries. I've seen blueberries. There's a lot of blueberries in Europe. Apples, banana, dark green vegetables, garlic, carrots. These are all antioxidants. Also, you can benefit from omega-3 and nuts. Nuts good for your memory. I saw, my wife one day brought me some, what do they call it, this chestnut or, other jaws. She said, he said, look, it looks like a brain. This will help your brain. And it's true, nuts help memory. Chew gum. Dr. Thaar says to chew gum will help your memory. This is also one of the studies that just like the rosemary thing. It's very, very doubtful for me. But if you chew gum, this will ease the stress. I know, most of these coaches in football, they chew gum. This will ease the stress because the stress will cause what? Will cause contraction of the temporalis muscles and masseter. And then if you chew, you will use them so they won't get into spasm. You won't get headache. You won't get stressed. But it helps. It says help your cognition. Chew more. Right. Last two things. Play brain games. I always play Sudoku. Right? Sudoku is a very nice game because brain just like muscle. If you don't use it, it will atrophy. So more use your brain more, you will get better memory. And the last thing is exercise. Scientists believe that increased blood flow, because exercise will increase the blood flow to the brain, and it will ease the stress actually. The stress of exercising will give you some endorphin and some dopamine, and this will make you happy and improve cognitive performance. So research has shown that adults who walk regularly gain hippocampus volume as opposed to those who do not. That's why, in Europe or in most parts of the world, they get dog for old people and they ask them to walk the dog every day. So, and sometimes I ask the old patients, says, are you walking your dog? He said, no, doctor, he walks me every day. So he has to take him for a dog. And walking the dog is a very good exercise. All right. This is the references that you may hear. Right. Have I forgotten anything? Right. This guy hasn't forgotten anything, right? And lastly, a big thank you for you all. Thank you.
And a big thank you to you too.
Thank you so much. Thank you, Doctor. It was amazing information. Thank you so much.
Thank you. And You know, for the molecular bases, I didn't want to go into details because some of you might not find it interesting. So you can, if you're interested, you can review it yourself. Thank you for attendance, all of you.
Okay, I know that we're past the time, but we will dedicate 5 minutes to answer your questions with the help of Dr. Thayer. So feel free to raise your hand so I can call on you to ask your question, or you can put it in the chat box. We already have a question. Sorry for the background noise. We already have a question in the chat. Is auditory or visual person a good learner?
Auditory or visual person. If you involve both of them, your eye and your ear, it's better. Some people, you know, they think of memory as if it is a learning, because learning is how to memorize things, you know, and memory will help you to retrieve previous knowledge in dealing with a current one. You should involve them both, right? But if you read, so have you tried that? Reading a lecture or listening to Dr. Thayer talking about it? Which one is better for you? Probably each one of you will prefer one or two, one or the other. You see? But the idea is to involve as much as you can of your senses. More sensory inputs, better learning and better memory.
And there's a second question. If someone's memory is damaged because of depression, how that situation can be treated?
It depends on the type of memory loss. As I said, there is antegrade and there's retrograde. Memory is, you know, when you get new information, you encode and put them in the short-term memory, and then you consolidate them into a long-term memory. Long-term memory are stored in a different place than the short-term memory. So there's nothing which will erase everything. What erase short-term memory might keep your long-term memory. Long-term memory cannot be erased all of, because it is stored in different parts and different aspect of it. So if you have like the visual aspect of the memory, because you have problem with the visual lobe, with the occipital lobe, you will still remember the fact, but probably you cannot, you know, remember the visual effect of that. You see? So there's nothing which can erase anything. Most probably you will lose the short-term memory. That's why, you know, long-term memory is because it's encrypted. Well, they call it in Arabic, you know, they call it العلم في الصغر كالنقش في الحجر, you know, as if you are encrypted in stone. So it will remain there. And as I said, long-term memory involves neuronal change. I didn't talk about it, but it's in the lecture, you can see it.
Okay, and since we're past the time, we will take one last question. Is caffeine a stress reliever, and how much caffeine is normal in a day?
Well, when I was a student, they used to tell us not to drink a lot of caffeine, but the caffeine is a very good cognitive enhancement substance. At the same time, you know, caffeine, if you drink a lot, it will ease the, you know, the sphincter of your lower esophageal sphincter, and might cause regurgitation, you see. And but caffeine can improve your performance. Plenty of it, I don't think it's harmful, but it can be that useful, probably.
Dr. Thayer?
Jinawi, yes.
I have a question. Using caffeine with paracetamol drugs, or the drugs that contain caffeine and paracetamol together, help you to be more active, or help you to sleep?
Yeah, I've seen these analgesics, which are a combination of paracetamol, ibuprofen, and caffeine. it probably has some sort of mind relaxing, you know, because pain is not only it's a subjective feeling. Sometimes the caffeine helps to relax, and this relaxation will help the pain. Because, you know, if we are subjected to the same stimulus, me and you, probably you might feel the pain more than me, and I might feel the pain more than you. It is a subjective feeling. Caffeine can help this subjective feeling, the psychological aspect of pain. But it's not harmful. But you know, these drug companies, they do whatever, you know, just to make something that they can make some benefit from it, you know.
Thank you, Doctor.
You're welcome, Shinawi.
Okay, so I think that's it. It was a lovely presentation. Thank you for your time. I know that you worked really hard to prepare this, and we appreciate it a lot, everyone on the Zoom. And we don't have